Hello, my name is Dr. Blair Washington, and I'm a senior physician editor and one of the physician annotators working to validate MCG's AI agent. I now have the pleasure of speaking with Miriam Moerbe. Miriam is a senior clinical integration analyst at MCG, and she is also part of the team working on agent user acceptance testing. Miriam, I appreciate you joining me to discuss how MCG is building an AI agent that can accurately reason over our clinical guidelines. Can you describe for me your role in validating our agent? What is MCG doing to ensure that our agent can be trusted to accurately reason over clinical data and our MCG care guidelines?
Sure. Thanks, Dr. Washington. So, as a clinical integration analyst, part of my role is to start out by understanding what the AI agent is meant to do. What's the goal of it? What's the data that it's using? What are the applications that it connects to? And how is that clinical data being interpreted? And what is the intended output of that AI agent? And so once I have an understanding of kind of that whole package, and I'm sorry, but I'm talking with my hands, but once I have an understanding of that whole package, then I spend a considerable amount of time starting to ask questions, analyze, and test the AI agent out, and testing its output. And what I'm looking for is an accurate clinical patient picture that the AI agent can then use that accurate clinical picture and reason over it with our MCG guidelines. And so there again, I'm asking lots of questions, I'm analyzing, and I'm testing all of this from the user level, looking at it to make sure that the intent is true and the clinical picture is there. And I get really excited when I start talking about this because I feel like it's something that is very groundbreaking with MCG and across healthcare in general, really. Because as the CIA, this role, what we're doing is actually we are helping to build clinical integrity into artificial intelligence technology. And to me, that's very groundbreaking.
That is, thank you for that response. And it sets me up for my next question, which is, how do you see our agent supporting utilization review efficiency and doing that accurately?
Sure. So it starts out by making sure first we have the appropriate clinical patient picture, right? And that the intent of our guidelines is also being used with the appropriate intent. So with that combination of both of those, these AI agents are really powerful tools. And the AI agent as a machine, artificial intelligence, right? It quickly sorts through this galaxy of data, whether that be data in the concrete form or the objective form of like vital signs, labs, medications, those types of things that are pretty concrete, right? But it also can look at the narrative text from documents or from faxes. So all of these different types of data, the AI agent can look at this galaxy of information, and it can do it very quickly, very rapidly, and very efficiently so that this frees up the time for the clinician. So as it's going through this galaxy of information, the clinician isn't having to sift through all of the medical information, all of the pages of information. And the AI agent actually surfaces up the relevant information for a decision that can be made. And at the same time, it can also provide insights into the patient situation. And it saves time, it saves frustration, and it creates a lot of that efficiency. And I think one of the most transformative things with an AI agent is we all we all have an understanding of the amount of patient data that is available to us, but it's about using it to turn it into information. And we as humans have limitations, right? We can't rapidly assess all of those things at the same level an AI agent can. And an AI agent can take some of that information and that data that might have been overlooked before or hidden in a patient chart. Then now it's brought forward and you have a much clearer, more accurate picture of what's going on with the patient. And, I get excited about this stuff because accuracy to me is really about being consistently free from errors and consistently getting it right. And I think that's the realm in where this AI agent is really going to help with accuracy and efficiency, because it's going to move us closer to being able to have greater accuracy and efficiency in utilization review.
Yeah, I've definitely found that too, that the agent will find data in the patient's medical record that I didn't find initially when I started the annotation process. So it's pretty incredible. Yeah.
Yeah.
What concerns do you think clinicians might have about relying on the agent for utilization review, and how are we trying to address those concerns?
Yeah. So I think one of the number one things that I've heard in kind of attending different things is that, will this take my job? Right? The clinician in utilization review is concerned about this, this, this image of artificial intelligence taking over their job. And I just don't think that's going to happen. There is always going to be the human in the loop. Do I think it's going to change what things look like? Well, sure, we have a new tool, right? And it's for the positive. It's going to change how we do some things, and it's going to do it for the better. We want the AI agent to be this supportive, integral tool that takes on all of that routine, time-consuming work, so the clinician can focus more on those complex cases, practicing at the top of their license. Because when I started looking at, the 200 pages of a fax that comes in and trying to look at different pieces of information, and the AI agent can pick it up in a matter of seconds, I'm like, ooh, that's pretty impressive, that type of thing. So I think freeing up the time where we can, and then allowing the clinician to focus on those complex cases where it's not so straightforward and you really have to dig into it a little bit more as a clinician. So that's one thing. The other is, and I think this is across healthcare, and no matter what we talk about, is how can I trust AI? That's the question that's on everybody's minds, because you hear about hallucinations, you hear about all these different things. Well, here's where I think MCG's foundation of trust and our transparency and being rooted in trust is the differentiator for us from everybody else, because MCG has always been rooted in trust from our transparent content. And it's that foundation that allows us to grow with innovations like AI agents. The AI agent for us isn't a black box because it's built on our transparent content. So our clinicians understand, they can see our content, they understand how the decisions are made because of that transparent content, and they can verify the results for themselves. And it's that transparency, that foundation of trust, MCG being rooted in that trust, that helps solidify the confidence in using the new technology of AI agents at MCG.
Thank you so much for talking with me this morning, Miriam. And I guess we better get back to work, huh?
Thanks, Dr. Washington.